interfere with the flow of the blood. Okay, it may interfere with the flow of the blood. The causes of the peripheral vascular diseases, that the causes basically the blood vessels become narrow, block, or spall because of when plaque gradually forms inside the artery walls. Okay, so the plaque is the the structure, abnormal structure, which results as a process of atherosclerosis process, and that plaque can narrow the blood vessels. Okay, next, it can happen in either arteries or veins. So this disorder can involve both arteries and veins, but mainly arteries are mostly affected. The effect of peripheral vascular disease. What are the peripheral vascular disease effects? So you can see if the arteries become narrowed or blocked, blood cannot get through it to nourish the muscle tissues. The blood usually circulate through the blood vessels. The purpose of the circulation of the blood is it nourishes cells, tissues of the muscles, of the organs. So when the blood vessels, basically the arteries, become narrowed or blocked, blood cannot get through it, and muscles, tissues may not get the nourishment, cannot get nutrients, cannot get sufficient oxygens. So the muscles of the lower extremities shows cramping and also loses strength, right? So lower extremities, we are talking about our leg. We sometimes feel cramping, or sometimes we lose strength in the our legs. The blockage in arteries of kidneys and intestine can lead to poor blood flow to these organs, and ultimately leads to tissue damage. So if there is a changes of phenomena, like if there is a abnormal plaque formations in the arteries of kidney and the intestine, then it causes blockage in these arteries, and further it can lead to poor blood flow to these organs, and ultimately lead to damage to the these tissues uh, present in the organs. Okay, how damage takes place? Because it will restrict the blood flow, right? Because of the narrow blood vessels sometimes become blocked. So when there is a blockage in the arteries, so it will not allow the blood to flow, and the blood may not be able to nourish the tissues. So the tissues may start to die. So there is a damage in the tissues because of the cell death, tissue death, right? Hypoxia is the one medical term that you usually know, that decreased oxygen tension in the tissues. Why it occurs? Because of the the phenomena that we have learning here, the blockage of arteries caused by the atherosclerosis process. So it may leads to hypoxia also. Okay, so in the absence of oxygen, in the absence of nutrients, the cells start to die, and finally there will be the tissue damage. You can see the image. This is the normal artery, and another is a abnormal arteries where there is a atherosclerotic phenomena, the plaque formation. Because of that, the blood vessels has become narrow, so blood may not flow properly in these narrow blood vessels. And when there is a blockage in these blood vessels of this particular area, you can see it's in leg, the lower extremities. So the muscles shows cramping, and the muscles shows lower strength, the weakness, right? And now we call this condition as a peripheral vascular disease. Okay, so this kind of symptoms may appear anywhere in the body. So mainly we are showing, this is what showing the lower extremities, lower legs, which where there is a plaque formation. So the symptoms usually show here as a weakness, tissue damage. Okay, these things. In healthy arteries, a smooth lining prevents blood from clotting and promotes steady blood flow. So if you talk about the healthy arteries, where there is no plaque formation, so the inner lining is very smooth and there will be no blood clotting and there will be the proper blood flow. So our cells, our tissues gets proper nutrients, proper oxygens. But if this healthy arteries are transformed into the abnormal arteries where there's a plaque formation, so uh, tissue damage occurs, the muscles get becomes weak, and sometimes the muscle cells start to die. So this is they are the effects of peripheral vascular disease. There are some symptoms the people may experience when they have a peripheral vascular disease. So pain areas, usually the sensation is like pain. Someone is willing to join. Let me see. Okay, Mohammad Munaf. Welcome, Mohammad Munaf. Okay. So these are the symptoms we are learning about the peripheral vascular disease, where the people may experience pain basically in the buttocks region and the leg region. Okay, these buttocks and legs arteries or veins are usually affected. Pain conditions are usually the pain usually they feel during the exercise or when they walk. So at the time of exercise, at the time of walking, the pain sensation usually starts because the exercise, the walking condition, blood flow is needed so that the blood can provide sufficient oxygen and nutrients to the muscle cells for muscle movement, muscle contraction, relaxation, So at the time of the blood circulate and there is a turbulence in the blood circulation. So usually there is a pain when there is a turbulence in the blood circulation. The pain sensation is improved with rest. So this is what happens, that when they feel pain and after when they start to take rest, so after that, after taking rest, the sensation of pain usually decreases. The skin become cool. There is a symptoms of loss of hair on the legs. There is a thinning of the skin on the legs, or there can be sometimes ulcer formation because of the tissue damage or tissue death. What is the treatment for peripheral vascular disease? Self care is the better treatment, where we can do physical exercise to prevent atherosclerosis like condition. Quitting smoking is suggested because smoking enhances plaque formation. Heart healthy diet. This is very important, that when we eat, we need to change the eating style into healthy eating style, and it should be uh, compatible with the heart healthy style, healthy heart healthy diet, right? So that the heart become healthy, should not take a lot of cholesterol, and the medications we can uh, refer to as a intake of medicines in the form of statin, vasodilator, or anticoagulant. The statin we can take as a medicine which can lower the cholesterol level in the blood, whereas vasodilator has the property to open or widen the blood vessels, and the anticoagulants can prevent clotting of the blood. Usually they are called as a blood thinner. So these are the treatment suggested. Self-care is for prevention, right? And medication basically for the treatment, right? Medical procedure can be done basically angioplasty. Angioplasty is the medical procedure which can be done to, cure the peripheral vascular disease. So angioplasty is the medical procedure, the surgical procedure can be done. Now let's know aortic aneurysm. What is aortic aneurysm? An aortic aneurysm is an enlargement of the aorta to greater than 1.5 times than the normal size. Here, aortic aneurysm is a medical condition where the aorta size becomes larger. So there is enlargement of aorta. Okay, aorta is the largest blood vessels. You need to understand that aorta is the largest blood vessels, and when the aorta size becomes larger, then we call them as a medical condition. As a medical condition, the enlargement of aorta, it is presented as a aortic aneurysm. Okay, so aneurysm means enlargement, right? Usually causes no symptoms except when ruptured. So when this aorta become enlarged, so there is no symptoms, but when this is ruptured, when this is damaged, then the symptoms can be shown. And occasionally there may be abdominal, back or leg pain. So the pain can be seen basically in the back, abdomen or leg. And affected area are mostly abdominal aorta, right? So abdominal aorta is mostly affected, where the aorta of abdominal aorta becomes larger. Sometimes thoracic aorta is also enlarged. So we can see in the image the branch of the aorta, basically the abdominal aorta, has enlarged. So aorta with enlarged abdominal aneurysm, right? So there is a ballooning or balloon-like formation inside the aorta of the abdomen, right? And you can see the both aneurysm at the thoracic region and aneurysm at the abdominal region. So when there is an aneurysm in thoracic region, so we call thoracic thoracic aortic aneurysm. When there is an aneurysm in the abdominal aorta, so we can say abdominal aortic aneurysm, right? So both the image from the, you can see this area where there is enlargement of aorta at the thoracic cavity. Okay, so here the thoracic aorta will be affected. When there is just aneurysm in the abdominal aorta, so we can say the abdominal aortic aneurysm, we can call them. Okay, so mostly what we say, the mostly if you see the prevalence, the abdominal aorta is highly affected, which becomes aneurysm. Next we are going to learn is aortic dissection. What is aortic dissection? Aortic dissection is a serious condition. The inner layer of the aorta tears. Here, what happens in aortic dissection process? The aorta, which is the largest blood vessels, so the inner layer of the aorta is tears, and then the blood flows through the tear, causing the inner and the middle layers of the aorta to separate. So this is what called as a dissection. Okay, the separation of inner layer and the middle layer because of the flow of the blood through the this tear. You can see in the image, okay, that this is the aorta. Okay, and now we can see the blood in wall of artery. There is a blood inside the wall of the artery. So inner and middle wall there is a blood, and this is the blood in artery. So lumen of the artery there is a blood, but this blood can enter into the inner and middle layer because of some damage to the inner wall, right? And it causes dissection, means separation of inner and middle layer of the aorta. Okay, what are the symptoms? Pain areas, here you can see the abdomen and middle back. Okay, so abdomen and middle back there is a pain like sensation, and the whole body there can be the dizziness, and then sometimes the patient may become faint, or there can be the low blood pressure. Common symptoms are like acute severe chest pain, nausea, shortness of breath, and there can be the loss of consciousness. Okay, so these are the symptoms we have studied. Uh, we have studied peripheral vascular disease. We have studied uh, aortic aneurysm. Now, let's go to the next slide. This is the about Takayasu arteritis. Takayasu arteritis is a rare type of vasculitis. What is vasculitis? Vasculitis is the inflammation of blood vessels. Okay, so Takayasu arteritis is a rare type of vasculitis where blood vessels is inflamed. There is inflammation of the blood vessels, and the etiology is unknown. So why it occurs, still it is not confirmed. So it's idiopathic type of disorder. The inflammation damages the aorta and its main branches. So this is the changes takes place where the inflammation, when it occurs, then it usually damages the aorta and its branches. Commonly affects women of childbearing age. So women are highly prevalent. This condition, Takayasu arthritis, is usually seen in the women of childbearing age. But if you talk about why it occurs, the reason is not known yet. So unknown etiology. How is Takayasu's arthritis diagnosed? So a doctor often orders an angiogram when the patient has symptoms and abnormal results of the physical exam. So if there is abnormal, when the doctor do physical examination, and when there is some symptoms related to this Takayasu arthritis, then the doctor uh, usually asks the patient to go for angiogram process, and the angiogram usually shows abnormal reports, and based on that it can be diagnosed. So we have completed our discussion on peripheral vascular disease. Then we have discussed aortic aneurysm, and we have also discussed about Takayasu arteritis. Now, if you have any question, we can discuss here. Let me turn off. Okay, any doubt? Please ask.